Facial palsy refers to either a permanent or a temporary condition where you cannot use your facial nerve properly. It's not only movement that's affected, but also the facial nerve controls the front two-thirds of the taste to your tongue as well. Facial nerve can be damaged either in a stroke, for example, and I'm sure you've seen patients with strokes who can't control one side of their face. However, the type of facial palsy that surgeons get involved to help with in the realms of plastics and reconstructive surgery is a different type of facial palsy, which only affects the facial nerve, and most commonly from Bell's palsy, which is a condition where out of the blue, the facial nerve can stop working, but in the vast majority of cases, patients do much better and improve with time. However, there are many patients with Bell's palsy who never go back to fully in terms of their function. It can affect either adults or even children who are born with congenital facial palsy. That's when they're born with the inability to use the facial nerve, either a branch of it or multiple branches. And that could be one side or both sides, but it is quite rare. In terms of what can be done, most patients benefit significantly from facial physio with a specialist and also can benefit from the use of Botox to try to either paralyze the unaffected side to give better symmetry, or even the affected side where sometimes you can get involuntary contraction and tightness of the muscle, which can be alleviated with Botox. The other options that us surgeons can discuss are things like doing a brow lift to improve the resting level of the eyebrow, or inserting weights in the eyelid like platinum or gold weights to help with the eyelid closing. And sometimes surgery can be done to tighten the lower eyelid to help with full eye closure, which can be an issue with patients with facial palsy. Other types of surgery can be done to improve the smile. That can be either what we call static reanimation, which means using slings that we can borrow from the leg, where we can tighten the face on one side, or more complex surgery, which involves taking tissue from one part of the body and moving it to the face and bringing a new muscle to the face to help with smiling. The treatment and management of facial palsy is very complex and is multifactorial, and there's various different methods that can help, and it's very important to see a specialist in facial palsy either by an MDT setting to get the opinions of various surgeons about how they can help you achieve a better outcome and a better smile. It's very important for patients who develop symptoms of facial palsy and weakness in the face to seek medical attention urgently to rule out a stroke, and also to initiate treatment for Bell's palsy, which is usually steroids and antiviral treatment.